All right, I'm going to call this meeting to order. Welcome to the last day that we're going to do any Senate files in labor health. So today, what we're going to hear is Senate file number 121, Wyoming Pharmacy Act amendments. And here to present that, I believe, is Senator Dockstader. So welcome. Oh, before you start though, let's take roll.
Senator Crum. Here. Senator Hutchings. Here. Senator Scott. Here. Senator Steinmetz. Chairman Brennan.
Here.
We have a quorum.
Thank you. All right, Senator Dockstader, when you're ready.
Thank you, Madam Chair,
Ready.
members of the committee. I'll present the bill and then it's going over with folks in pharmacy. They have some concerns, and so we'll bring them up at your will and further discuss it. But let me at least do a presentation if I could too first, okay? Thank you, Madam Chair. Bring you Senate File 121, Wyoming Pharmacy Acts amendments. Amends the provisions related to the practice of pharmacy, the age of the patients to whom the pharmacist can provide immunizations. Quick overview of the bill and the changes comes on page 2, which establishes what a pharmacy is. Counseling component on page 2 as well, the pharmacy rules, the pharmacy care, patient safety and services. Page 3, we know the requirements for training, education, and experience, and the requirements of collaboration. With that, I'll further explain, Madam Chair, that what we do here with this bill, it essentially strengthens rural health care. Many of our communities face provider shortages, have long distances to travel, allowing pharmacists to prescribe certain medications and devices such as glucose monitors and antibiotics after a positive strep or UTI test helps fill the care gaps and expands timely access close to home. It also supports the state's healthcare expansion goals. Legislation empowers the Board of Pharmacy to create clear, responsible rules to expand pharmacy services, directly fulfilling Wyoming's grant objective to improve healthcare services, particularly in the rural communities. For 3, it allows for immunization coverage when it's wanted by those who would seek it for their individual care, for their family's care. It enhances chronic disease management and preventative care. Pharmacists are highly accessible healthcare professionals, expanding prescribing authority for specific medications and devices improves diabetes management, preventative care, and early treatment, thus reducing complications and overall healthcare costs. And it still allows pharmacists to use their professional judgment. The bill ensures employers cannot require pharmacists to enter into collaborative practice agreements if they do not feel comfortable or sufficiently knowledgeable in a given clinical area, thus safeguarding the patient safety and professional integrity. I'll go over some of the points here. Madam Chair, 3324-124. This broadly defines the practice of pharmacy, for pharmacists. This includes interpreting prescriptions, counseling patients, accessing patients to prescribe drugs or devices according to board rules, providing care services, using technology to ensure safety, collaborating with physicians, managing drugs in pharmacies or facilities. Participation in collaborative care is voluntary, and the board establishes the rules. That's 3324-124. Let's go to 3324-157. It authorizes the licensed pharmacist to prescribe and administer recommended immunizations to healthy individuals under the age of 3 and older patients in private settings as approved by the board. Parental consent is required for minors. Immunization records must be entered into the state health registry. Pharmacists may decline to immunize children under age 13 without employment consequences. Section 2, rules are required. The pharmacy board must establish rules to ensure safe implementation. Section 3, when it starts, the changes come effective July 1st, 2026. Rulemaking in this section is effective immediately after the bill becomes law. The bill maintains pharmacy practice safety through board oversight and does not require participation in the expanded practices. Ultimately, its goal is to improve access in the rural areas without altering provider roles. That's where we're at. I understand we have some people that like to testify, and there may be some concerns there, so I'll let them explain that further. And I will step back unless you want me to stay at the table, Madam Chair.
I'll just, committee, any questions for Senator Dockstader? Senator Steinmetz?
Thank you, Madam Chairman. I just wondered why the change from 7 to 3 on page 4? Is there something that has changed?
Madam Chair, that was a recommendation from the pharmacy folks. A little background on this, Madam Chair and members of the board. I traveled up to a meeting with these folks in the summertime in Casper to kind of oversee some of this. And they were roughing out the ideas at this point, and this is what finally came together.
Madam Chairman,
Senator Scott?
Madam Chairman, Senator Doctor, I can't hear you even with my hearing aids.
Okay. Anyway, we started this, Madam Chair, for Senator Scott. We started this last summer with a meeting with our pharmacy folks in Casper at their summer convention, I believe it was.
Any further questions for Senator Dockstader?
Madam Chairman.
Senator Scott?
Madam Chairman, page 3, lines 20 and following, goes over the next page. It says nothing in this section shall be deemed to require any pharmacist to provide collaborative pharmaceutical care. And then it says no employer shall discriminate against a pharmacist on the basis pharmacist declines to participate. What do you do? Suppose, Madam Chairman, you are, as most of them are, pharmacies are a unit of a chain store. And they say, we're going to provide this collaborative care and we're going to promote it and try to get patients in. Based on that, it seems to me this forbids you from saying a pharmacist who says, I can't provide that. You can't, how can you employ those if you're going to try to make that part of your strategy to provide that care? Madam Chairman, I'd like a little discussion on that section because I don't think it works.
Madam Chair,
Senator?
Madam Chair, Senator Scott, it's my understanding, and we can adjust it if needed. The bill ensures employers cannot require pharmacists to enter into collaborative practice agreements if they do not feel comfortable or sufficiently knowledgeable in a given clinical area, safeguarding the patient safety and professional of the integrity of the profession.
Thank you, Senator Dockstader. I believe that would be the purpose of that, is that a pharmacist wouldn't, and we can hopefully have some other public comment, but that if they're not, if they didn't feel comfortable in that, or
Right. Madam Chair,
specific, sometimes there's specific training that you just take in medicine to be able to do things.
Madam Chair, be happy to let those who testify explain that further. And then I just learning of some concerns literally just moments ago, so I'll let them testify. Okay.
Okay,
Okay. Thank you.
we will then bring up, do we have anybody from the Board of Pharmacy here?
Good afternoon, Chairman Brennan,
Welcome. Yeah.
and members of the committee. My name is Matt Martineau. I'm the Executive Director for the Wyoming State Board of Pharmacy. Madam Chairman, Senator Steinmetz, with respect to your question about the decrease to the age of 3, that was in response to all right.
Thank you. Go ahead and proceed.
Yeah. So again, in response to your question about the decrease in the age to 3, that was following the response post-COVID. During the PrEP Act, federally, they put out and decreased the age that pharmacists could administer immunizations to children as young as 3. And the vast majority of states followed that precedent where they have an age limit or restriction on there. So this follows that, that federal guideline, I guess you'd say. And then Chairman Scott, with respect to your question, that language about not discriminating against a pharmacist that chooses to not participate in collaborative practice, I believe that was trying to follow the same protections that are in 157 that were put in when that section was authored, 10, 20 years ago, when pharmacists were first being given the authority to prescribe and administer immunizations. And there were some who were concerned about whether or not they wanted to engage in that practice and they didn't want to feel discriminated against. So my understanding is that it's a similar protection that, as you're talking about increasing the scope of practice for pharmacists to be able to do more under collaborative practice, that they won't be discriminated against if they choose not to enter into those agreements, because it's a two-sided agreement. The pharmacist has to agree to do what's being outlined in the collaborative practice agreement, and the practitioner has to likewise agree that the pharmacist is going to be able to do these things that are being delegated to them or outlined in the agreement for them. Does that answer your questions on those 2 points?
That does. Any? Senator Hutchings.
Thank you, Madam Chair. Mr. Martineau, just to go a little bit further into the 7 to 3, if we were to amend that and just say we're going to keep it at 7, what kind of, what issue would that cause to the bill? And number 2, if you don't mind me stacking up on you, the way I look at this, because we're dealing with rural areas, my thought is there may be a mom, a father that has a child that's 3 and they want them immunized and they can't drive, or they could, but they're choosing to go ahead and let their pharmacist administer the vaccination. You can have it as low as 3. Now, you don't necessarily have to, but again, that number 7 to 3 is kind of disturbing for me.
Chairman Brennan, Senator Hutchings, if you wanted to leave it at 7, that is your prerogative. The provisions of the PrEP Act have been extended through 2029. So at least with respect to flu vaccines and COVID vaccines, federally pharmacists are exempted and can administer those vaccines to children as young as 3 under those provisions. Like I say, putting it in statute and allowing it to go down to as young as 3 would allow pharmacists to administer any appropriate vaccine to a minor, as long as the parent or guardian wanted their child to get that vaccine.
Thank you.
Any further questions? Any further comments for us?
Other than, so then, yeah, that we identified some concerns with the bill. And I apologize that I wasn't able to talk about these with the sponsor before being here with the committee. On page 2, lines 1 through 3, it creates an interesting and confusing definition about who ends up practicing pharmacy and what ends up happening in the event that unlicensed practice happens. The way that the act is written right now, it's unlawful to run a pharmacy without it being licensed by the board, and it's unprofessional conduct to employ directly or indirectly someone who isn't licensed by the board. So you can't run a pharmacy without a license, and then you can't hire pharmacists who aren't licensed by the board. The way that this is written, and then the functions that are talked about subsequently in B, these are all things that can happen outside of a pharmacy. And so A appears to decouple the protection about a license requirement to practice pharmacy, because everything right now is built around it being associated with the employer. And now you're talking about pharmacists doing things that don't necessarily have to happen at a pharmacy or a licensed location. And so, like I say, there's no deterrent, there's no remedy, like there is in the Wyoming Medical Act. I believe it's 3326-410, where it talks about and says that it's a misdemeanor to engage in the practice of pharmacy or to aid and abet someone in the practice, or not pharmacy, pardon me, to practice medicine or aid and abet someone in the practice of medicine who isn't a licensed practitioner by the Board of Medicine. So, like I say, A ends up creating this weird thing or a weird state where you're only practicing pharmacy if you're a pharmacist. So if you aren't a pharmacist and you're doing these things, are you a pharmacist? Isn't as a license required? It just creates a really odd situation. Like I say, where there is no apparent deterrent to that. On page 2, lines 8 through 9, Roman numeral 1, it lists interpreting, evaluating, compounding, dispensing, or administering medical orders or prescriptions as the practice of pharmacy, which again is limited to a pharmacist. Historically, the board has looked at and allowed compounding to be done by other licensed pharmacy individuals, pharmacy technicians and interns. By putting that in here, it ends up making it a pharmacist function. And so it becomes again unclear if that's something that the board by rule can still say can be delegated then to a technician and could be supervised by the pharmacist to do those things.
Yes, go ahead. We'll start Senator Hutchings and then Senator Steinmetz.
Thank you, Madam Chair. Mr. Martineau, the two that you brought up so far, A and I, Romanet I, do you have any suggestions on how we can amend it to make it sound better or look better or be better?
Thank you, Senator Hutchings. You've asked what we're all wondering.
Chairman Brennan, Senator Hutchings, my understanding is that the way that 3324-124 has been looked at previously is that these were all things that were considered part of the practice of pharmacy. And that statute didn't previously limit it to only pharmacists doing those things. So I don't know if you would want to strike out on line 6, a pharmacist. So lines 5 through 6 would potentially read practice of pharmacy means, but is not limited to, oh, pardon me, a pharmacist. So you strike the last bit there at the comma. So then the practice of pharmacy is any of those things.
You think that would help you, sir?
I don't know, because again, then you're still talking about some things that are, all of these functions are things that do require the pharmacist's training to, and are prohibited functions by a technician. So I don't.
Madam Chair, would it help to insert the title 32 or 3326-410 somewhere in A to kind of clarify what, if someone wanted to look this up, they can go back and say, this is what we mean by this.
Well, Madam Chairman, Senator Hutchings, 3326-410 was the Medical Practice Act, and that was one of the references about it being a misdemeanor to practice without a license. B 1 through 8, you're now talking about the practice of pharmacy and it being things that the pharmacist is doing. And one of the things that you're talking about that is now a pharmacist only function is something that technicians and interns were previously allowed to do. So I don't know if it would be better to have something regarding what could be delegated by a pharmacist, or if we just need more time to wordsmith some stuff and come up with an idea to try to correct that. But like I say, it just ends up taking this one thing that has been allowed by other licensed professionals, and now you're putting it firmly in the bucket of, no, this is a pharmacist function.
Okay, I think committee, what we'll do, was there any other problems that you found?
Chairman Brennan, yeah, on page 2, Roman numeral 3, and then on page 3, Roman numeral 7, those appear to create conflicting requirements. Roman numeral 3 says that assessing the patient for the purpose of prescribing drugs and devices is going to be done pursuant to Board of Pharmacy rules. So that appears to put the board in a proactive position of having to promulgate rules to that effect. On page 3, Roman numeral 7 talks about the acts that are consistent with the pharmacist's training, education, and experience that are not expressly prohibited by the act. So that seems to put the board in a reactive position. Or if it's not reactive, then having to, again, proactively promulgate a list of do's and don'ts. So the two, like I say, they end up creating a conflicting set of scenarios of, does the board try to outline everything that the pharmacist can do and can't do? Does the board only outline a list of things that pharmacists can do and then wait for the complaint-driven process to happen and have someone that may have been injured by a pharmacist who was operating way outside of their training, education, and experience? It just, like I say, creates a conflict of how does the board try to promulgate rules to the effect that to address this increased scope of practice.
Okay, thank you. Yeah, just. Go ahead. Okay, so let me make sure that we've got an understanding kind of currently. Because my understanding is this bill was brought forward because there's things that pharmacists are trained to do, but they can't currently do because they're just not.
It's not within their scope of practice.
Not within their scope of practice per Wyoming, but they're trained to do. So one example that I've run across is we've got pharmacists that they're trained to give certain medications. But for example, where I work up in the ICU, they can't push any medications during a code, which we would really like them to be able to do. So it's those kinds of things where they're trained to do, but because of our statutes and the way things are, they're not being able to really practice with their under the full scope of practice. So I think that's what we're trying to do with this bill. And my understanding is that you guys as a board are a little bit limited on what you can and can't do as far as helping to expand that scope of practice currently. Is that correct?
Chairman Brennan, yes. Currently, the way that the Act defines the scope of practice for pharmacy, it doesn't include administration. So like doing an IV push is outside of a pharmacist's scope of practice. And since it's not something that the legislature has given the board can't give itself the authority to say, and by the way, pharmacists can administer drugs. So yes, this bill does a huge thing in terms of greatly expanding the scope of practice. It just, there's things that fall out of it as a result. So an example within the existing act, the act defines unprofessional conduct as when a pharmacist basically makes a medication error. If the doctor prescribes you amoxicillin and instead dispenses Augmentin, which is amoxicillin and clavulanate, it's the wrong drug. It's something else that the doctor didn't prescribe. Or if they gave you Bactrim or atorvastatin or anything else that the doctor wrote for, if they gave you the wrong drug, if they gave you the wrong directions, all of that stuff is a med error. The act allows pharmacists to do generic substitution, and generic substitution is when the doctor writes for Lipitor and says that substitution is allowed. So that means I can change it to the generic atorvastatin. What the act says that I cannot do is therapeutic substitution. And therapeutic substitution is where I could take a different drug from the same class and do that. So that would be like the doctor writing you Lipitor, me trying to bill it through your insurance and your insurance saying, we prefer simvastatin instead. And like I say, the act would prevent that, but then it becomes a confusing situation of how does that end up being addressed? Is that something that could be addressed and corrected via collaborative practice? Is that something that this is giving pharmacists independent authority to then take the prescription that the doctor wrote for you, store it on your profile, use their independent authority to prescribe what the insurance wants you to have, and then issue it? So has unprofessional conduct happened there? And then what happens if there's a medical reason why you need to be on this one medication and we just haven't been patient and let the prior authorization process go through or whatever, and there ends up being patient harm that happens because of the change that the pharmacist undertook under their own initiative?
Okay, thank you. Senator Steinmetz,
Thank you, Madam Chairman. My question is on page 2, lines 13 through 15. Assess the patient for the purpose of prescribing drugs and devices pursuant to the Board of Pharmacy rules. So what would that look? That to me sounds more like a doctor or PA or, I mean, do physicians always assess patients? Is that something they do right now? The pharmacists, do they do that? And what rules does the Board of Pharmacy have around that?
Madam
Go ahead.
Chairman, Senator Steinmetz, we have rules with respect to like immunizations because pharmacists have independent authority to prescribe and administer immunizations. So we have the criteria. If you're a healthy adult or a healthy minor, basically that means there's no absolute or relative contraindication to why you can't have this vaccine. You're not allergic to any of the substances. You don't have a condition like Guillain-Barré or something like that that might elicit an emergency. And so if you're a healthy individual, then the board's rules allow me as a pharmacist to prescribe and administer whatever vaccine it is that you're there for. So if you wanted the flu shot, if you wanted the COVID shot, if you're going on vacation into the tropics and you need yellow fever or whatever, I could do that for you under my own authority. This expands that scope of practice, and under 3, it would allow the board to promulgate rules and say, okay, are we going to have rules regarding managing high blood pressure medicines? Are we going to have rules regarding diabetes medications, and how does that management work, or what sort of guidelines do you use? And that kind of, like I say, kind of goes back towards some of the apparent conflicts with Roman numeral 7 when it talks about in accordance with accepted standards of care. That's open to debate as far as what is the accepted standard of care? Are we talking about only in Wyoming? Are we talking about using the latest study and guidelines? Are we talking about using some other federal entity? Are we running amiss if we choose to follow the federal guidelines or something like that? It puts the board in a very difficult situation to try to navigate. What are these standards of care then that we're using as the measure by how pharmacists are going to operate in this new space?
Follow up. So what would your recommendation be of this bill? And Madam Chairman, do we have to have this out of committee today, or do we have one more day on Friday to get bills out of committee?
it has to be out. We have to have it out by tomorrow.
Oh, by tomorrow? Because it just seems really broad to me, and I'm not opposed to the intent of it at all. It just seems extremely broad, and I'm wondering if anyone here has solutions or suggestions how to fix it.
So what I think that I'd like to do, because have we heard all the concerns of the board? I don't think I really followed through with my plan. Is that we would hear the concerns from the board. I think that there's some valid concerns with some of the way that this is written. That we would take some testimony, that maybe there would be some people with like some solutions, and that we can work the bill to the best of our ability and see then where we end up in this next hour. So, and Senator Dockstetter, if you have some suggestions, come forward. If we did, are you done with the,
Yeah, I'm
The
more than happy
concern.
to answer any other questions that the committee may have.
okay, thank you. Yeah, well, we will probably have more questions for you. Senator Dockstetter.
Thanks, Madam Chair. There are other people in the room who could testify. I'm fine with backing this down and getting it clarified further. This is something that was prepared that we thought we were going to start at another place in the building, so to speak. And then I picked it up and said, well, we'll carry it. So we need to do some work on it, but there are other people in this room who could testify as well.
Okay. Let's go ahead and take public testimony on this bill. If there's any public testimony, come on down and fill the chairs. Okay.
And for having me to testify. My name is Melinda Carroll. I'm the Legislative Director of the Wyoming Pharmacy Association. With those concerns that were raised about the practice, I would like to say that there is likely some solutions. Idaho has a standard of care. The nurses function under a standard of care. Doctors function under a standard of care, and pharmacists are really the only ones out there that have a proscriptive list of rules that we have to practice under. And to your point, Chairman, Senator Steinmetz, when you were talking about, this sounds like a function that a doctor or a PA, we actually have more education than a PA as a pharmacist, and are educated to do some assessment and to do point of care testing. So at my pharmacy, we do cholesterol screenings, we do A1C screenings. Currently with that, if I had a collaborative practice, I could adjust the patient's medications or initiate patient medications with that. Also, we have test to treat capabilities, which is one of the reasons why I think Senator Dockstetter did take this bill up, is because in a pharmacy, some pharmacists are trained to do testing to see if you have strep or the flu or COVID. And now with the way it exists, we would not be able to do anything with those results. We would have to send them to the doctor, or if we had a collaborative practice, we could then initiate therapy. So this opens it up to allow the board to make rules around that. Given the concerns on the bill, I do think there's an amendment that we could come up with to put in the bill that would address those concerns. I felt that the Director Martineau's point about taking out the word pharmacist would potentially be a fix for that, first initial one where the practice of pharmacy would encompass all of these things. And I do think adding something that is similar to the, medical act, saying that it is a misdemeanor to perform these duties, basically do a pharmacist's work and not be licensed as such. These concerns were new to me as well, so I have not wordsmithed anything yet that would be fitting for it. However, I would be happy to do that and try and do it on the fly if you guys would like me to. I do think this bill is very important because, as Chairman Brennan was stating, the administration piece specifically hinders a lot of pharmacists in the community. We can already administer immunizations. There's no reason that we're taught to administer pretty much everything because we have to teach patients how to administer. So we know how to do it. We're trained to do it. It's just we are not allowed to do it. And this is one of the many things that it's addressing, as well as expanding healthcare in Wyoming and our rural areas to have greater access for patients and have more touch points that they can get to so they are able to seek that care. Pharmacies are also open much later and have varying hours from provider offices, which also, if you have a kid that starts spiking a fever at 6 o'clock at night, it's a lot easier to go to the pharmacy and have some tests done than it would be to try and get an appointment with the provider at that time. So the intent of the bill was to open that access piece and to allow pharmacists to really fulfill the functions that they're trained to do and give Wyoming patients better access to healthcare throughout the state.
Thank you very much. I'm going to make some comments and then committee, if you guys have any questions, we'll do that and I think you hit on this, that what I see in practice is that pharmacists are trained, you go to school to learn about all the medications, the dosing of them. And because that's really where your focus and specialty is, that sometimes you can know those even better than a lot of the physicians. And I see a lot of physicians collaborating with pharmacists on what medication and what dosing should I use in a day-to-day basis. And then I think you make a very good point, and I appreciate you pointing out that you guys are trained to do these things. You teach patients how to do these things, and yet you're not allowed to practice these things. And we talk about this a lot at my work. It hinders even our patient care in a big hospital. So, committee, any questions? Okay. Next, welcome.
I am not a pharmacist. My name is Dale Steenbergen. I am the director of the Greater Cheyenne Chamber of Commerce. I also run the Wyoming Retail Association and the Wyoming Chamber of Commerce, which is a coalition of chambers all across the state. We make up about 12,000 business members across the state. So I would encourage the committee to keep this bill going. I think we all know that we are on the edge of a health crisis in Wyoming where we need to be able to deliver health care. So without the miracle of creating like 500 new doctors and implanting them in places like Lusk and little communities outside of Lusk and Shoshone and all these places, we have to figure out some new ways to do this. I think this bill helps us start down that path to do that. Senator Hutchings, you were asking about excuse me, through the chair, but you asked the question about why the decrease in age. I think as we talk to some larger companies that have pharmacies that have done this in other states, a couple of interesting things popped up. One thing they said was, we'd like Wyoming to match, of course, as all companies do. But as we started talking to local pharmacists, they said, you know, when somebody drives 30 miles into town and little sister gets a shot, but her little sister can't get a shot because she's 6 instead of 7, what happens to the little sister that doesn't get that shot? So I think that lowering in age is a good thing. You know, we have good people in pharmacy. They are trained. Let them do what they need to do. And frankly, if you don't have to drive another 40 miles so that you can get tested to find out that you have strep and somebody can help you with that, that would be a wonderful thing. Thank you, guys.
Thank you, committee. Any questions? Okay, yes, Senator Hutchings.
Just a quick one. Mrs. Carroll mentioned that she was willing to provide an amendment to us as quick as possible, and maybe she can work with Mr. Martineau to do something. I don't know if that was your intent, but I'd like to have the bill move forward. So just my.
Thank you. Any further public comment? Would you like to add something?
Madam Chair, Senator Hutchings, I was just going to say that I would be happy to work with whoever would like to work on that amendment. Again, I do have some, recommendations on language that we could potentially go with, but I would like to sort out those concerns a little bit further so I can have a better understanding of the language that is required. I too would love to see this bill advance. I do think it's an important bill. And I do think that it encourages collaborative practice. It encourages, the expansion of care in our state. And it really defines more closely to what a pharmacist actually can do in practice.
Thank you. Did you have something?
Yeah, Madam Chairman.
Senator Scott, yeah.
Having trouble with this bill. It seems to me that the pharmacists are one of our health professions that we are not exploiting the full value that they can provide. They get good training and then we limit their ability to use it too much. I'm having trouble understanding this bill as to how it solves the problem. It looks to me like there's a major drafting problem within the bill. And you look at the existing law and it describes pretty well what pharmacists have traditionally done, but it doesn't seem to honor the additional things that you can do, and that's a problem. But I don't see how this bill fixes it. So, Madam Chairman, I'm having difficulties. I wish this was a general session rather than a budget session.
Yes, I understand that. I think page 2, Romanet 3 gives some of that answers. But it will go ahead and continue taking public comment.
Chairwoman Brennan, if I could address Senator Scott's concern or question. With this bill, it does move it closer to a standard of care practice, which is what, again, our fellow people in nursing or medicine function under, where the profession itself, the professionals that get taught and get trained, come up with what it is to practice. And that is why the language was left so that it can be for board rule, because that is how the other medical professions function. The board comes up with the rules and what you can and cannot do. With this, the standard of care, if it was complaint driven, it would be, did you act in a similar fashion as somebody in your same position? If the answer is yes, then you didn't do anything that was concerning. If the answer is no, then you did. So with this act, it does move it to a standard of care to where we are just trying to have some equity with the other boards on that, where they can determine what their practice is.
Thank you. Further questions or? Okay. Swish.
Yeah. Madam Chairman, well, just go ahead and then I'll get a suggestion.
Okay, sounds good. Okay, yes.
Madam Chairman, members of the committee, good afternoon. Sheila Bush with the Wyoming Medical Society. We don't have a position for or against this bill specifically. I did want to offer some comments and gently push back on a couple of things that have been said. First of all, I think that I would be remiss if I didn't push back a little on the claim that pharmacists have more training than a physician assistant. I think what is probably more accurate is to say physician assistants and physicians have more training in clinical diagnostic care, and pharmacists likely have more training in pharmacology, which is why they have historically worked so closely together. When the Medical Society saw this bill, we contacted the Pharmacy Association, and we were assured that there was not an effort underway to undercut or remove any of the collaborative care requirements that live in statute now. And it would be our hope that this would not be sort of an effort to bypass the legislative action and take that conversation to just rules with the board. And so we were given assurance that that was not the case. We'd like the record to reflect that it's our understanding and our position is largely based on that sentiment that we were given from the Pharmacy Association. And finally, I would just say the collaborative agreement is so important to medicine because the diagnostics and the treatment of a patient really should be a partnership. And one of those big things is right now it's the physician who's checking a medical record, who is looking at the patient's holistic care and their history, particularly when you look at pediatrics. In most of our communities, those are physicians who have followed a child throughout their childhood, and they have that medical record. They know what other things are present. And it's not my understanding right now that all pharmacists in Wyoming would have access to that comprehensive medical record, hence the importance of that partnership. So with that, I would stand for questions. Again, we don't have a position for or against. If you do amend the bill, we'd very much like to be included in that conversation because this does fall so close to medicine.
Minnie, any questions? Okay, any further public testimony? Senator Dockstetter, would you come forward?
Madam Chair. Madam Chair, thank you, members of the committee. Maybe if we do, as I understand what you just said, we have one more day. Could you give us some time to bring the parties together, look at a feasible amendment, bring it back to you? I don't know how that works as far as timing for this committee though, and our deadlines.
We meet Monday, Wednesday, Friday. I think committee, if there's, what I hear is that there's interest in moving this and working this forward. I would be willing to see if, the members could meet tomorrow at some point or up on adjournment today to give time for some amendments and then come back and work the bill. I would be good with that if the committee is good with that.
Madam Chairman, and I'm just fishing here. I could certainly come back on adjournment, but what I'm starting to think is that what we ought to do is go to in 33-24-124, which is the persons deemed practicing pharmacy. Keep the existing paragraph intact as an item A, because it does define what pharmacists do pretty well. And then have a B section that is persons practicing pharmacy may, and then list most of the new items that you see on page 2. You wouldn't have to repeat page 3, lines 11 through 16, because that would already be, and that would be the A section. And the real question would then be, I think, page 3, lines 5 through 9, that VII section. Should we include that or not? And if we did something like that, maybe put a sunset date on that particular paragraph that would expire either after the next general session or the second general session, to give some time to essentially see what works. But I'm not sure that cures the problems, Madam Chairman, but that's the approach I'm going to suggest.
All right, thank you, Senator Scott. So you're saying that we would keep A as is, we would strike.
Yeah, make 3-24-124, make that existing language subsection A, and then have a subsection B that the practice of pharmacy may include.
And then I believe you said something about some language not needed, or was that, did I hear wrong?
Well, the text of A is found on page 3, lines 11 through 16 as VIII. That's mostly the text of A. So we wouldn't. we would no
Oh, okay.
longer need that there. We'd have that above.
So it sounds like to me, Madam Chair, if you don't mind. If we were to accept Senator Scott's amendments as a committee, we could advance this and maybe Senator Dockstader could bring the pharmacist amendment along with our amendments when the bill is presented to the committee of the whole. Is that where we're going?
Well, I think Senator Scott had a proposal for this amendment, which I think does probably fix things. Would the Board of Pharmacy come up? Does Senator Scott's proposed amendment seem to take care of the concerns that you brought forward?
Madam Chairman, I think it could use a little bit of tweaking, but I think it gets us a lot closer there. Restoring A, like Senator Scott says, preserves what the original definition of the practice of pharmacy was. And then by creating new B and C, the legislature is clarifying and adding, or however you want to say it, in terms of expanding the scope of practice. So that's just the tweaking of how do you have that? Is it that the practice of pharmacy may include these additional things? Is it persons practicing pharmacy may do these things? It wouldn't take much more tweaking, I don't think, but I think Senator Scott's on a roll there.
So then committee, what I'm gonna propose, I don't think we've talked to move the bill, but I'll just throw this out because I think Senator Scott's amendment does get at what we want. That maybe we could do more of a, instead of exact, a conceptual amendment, and then maybe Senator Dockstader and Senator Scott could just finalize the little tweaks on this. Senator Steinmetz, go ahead and comment.
When you're
Just
done,
an
Madam
idea.
Chairman, I didn't mean to interrupt you at all. Madam Chairman, I did hear the concerns of the medical society though as well. They were wanting us to set some pretty clear boundaries, and because there are 2 places that it talks about the pharmacy, the Board of Pharmacy setting rules or promulgating rules. And so I would just like to know if they feel like there needs to be more done in the bill, or if they're okay with the 2 areas where the Board of Pharmacy is making the rules.
Would, you guys like to comment? Come forward and comment? Mhm.
Madam Chairman, members of the committee, thank you so much for that. I want to work collaboratively with all of the sponsors and the people who believe that this is important. In no way do we want to be an obstructionist. I think it would help a lot to add language that would say that a collaborative agreement is, continues to be required. Just something that would at least require a conversation at the legislative level before a change that significant were made in rule. And how that was accomplished or gets accomplished, I don't have a strong preference, but it would be really important to us.
Right, thank you for that. Any further questions from the committee? I have one question. Are you aware, besides the pharmacist, of any other field within medicine where the board isn't allowed to make the rules on what those practices are according to the training that those individuals have received?
Madam Chairman, members of the committee, I think most of the health professions, actually, the Practice Act is fairly prescriptive that is legislatively designated. I remember when we had the ophthalmology fight, which I just dare to even mention. But at that point, it was a new precedent, and a lot of the conversation was around this reversal of we created language in the Optometry Act that says from this point forward, everything is the act of optometry unless it was restrictive instead of permissive. And I do believe that the Optometry Act, as of today, is one of the only acts in Wyoming that really functions that way. The rest of the medical or the rest of the practice acts are prescriptive, as in what is the practice of chiropractic, physical therapy, pharmacy, et cetera. And then there is latitude for the board to work within those and to set rules, but it has been the legislative prerogative to maintain control over what is and is not the practice of all of those professions.
Thank you. Comments in that area? Okay. Just, I guess, one more for you, Ms. Bush. On page 3, I do believe that's where we talk about kind of some of that collaboration. As the bill is written now, do you feel like it protects that collaboration between physicians and pharmacists?
Madam Chairwoman, members of the committee, I'm not positive. I think the way we read it when this first posted, I had concerns. Like I said, I did contact the Pharmacy Association. It was in communication with them that they said that they also believe that it's important. But I think if you read the language, it does say that it is up to the board whether or not that ever kind of gets removed. And I would defer to the director, of course, on their interpretation of that. But I'm not sure that it's certain that couldn't be opened up. And again, the reason that we feel like it's so important is pharmacists are the experts on the pharmacology. I think physicians and PAs, all of our prescribers in the state, look to them on a very regular basis as consultants and as equal partners in this journey. I think if you unwind the collaborative agreement, you open up a lane for pharmacists to start engaging in clinical practice, diagnosing a patient, taking a history, doing labs and running tests. And I feel like that is fully the practice of medicine. That's no longer the practice of pharmacy fully. And so I think having them work together in that is a really good idea, but to erase that bridge that exists today fully would be a mistake.
Any further comments or questions? Okay. Back with discussion then on the bill. And somebody remind me where we were at. We've not moved the bill. We're working ideas. So.
Madam Chairman.
Yeah.
I would be more comfortable myself, and I'm not speaking for the rest of the committee, having this group get together and come back to us with a proposed fix to this bill and getting a working group together if Senator Dockstetter is open to that, because I think it's an important bill. It's, I'd love to see us provide more services to our communities. We're all in the same boat, but I want to do it right too. And so I think there are some experts in this room that if you put your heads together, maybe you can all come up with a better solution than I could, because I don't know this well enough, and Senator Scott is quite an expert, but I'm certainly not, so.
And Madam Chairman, the trouble we've got is this is a 20-day budget session and we're overwhelmed by the problems with budget and the school recalibration.
Yeah.
And the time is, I think the real drafting problems in this bill. And I don't know whether we can get them resolved or not. I'd be interested to hear what Senator Dockstader thinks.
Thank you, Madam Chair, members of the
Please.
committee. What if we pull together a working group, take a look at this, see if it's approachable? We run past the committee, you, Senator Scott, and all parties involved, and see if there is an approach that we can take care of within the time frame. My concern is I come back to the committee and your schedule, whether we can still run it through the committee and have consideration. I'm not sure. Have you got anything else on the agenda, Madam Chair?
No, this is our last Senate file, and so I would be happy for you guys to put something together, bring it back to the committee. Committee, would you like, I'd be happy to either look at upon adjournment today or tomorrow at some point. So let me know what works good for you guys.
Madam Chairman, either one works for me.
Okay.
Madam Chairman, either one works for me, and you can schedule a meeting, and if we don't meet, that's fine, but at least you'd have it scheduled, but either way.
I'm totally open.
Okay.
Thank you.
Well, if it works for the committee, if we could schedule a meeting noon recess tomorrow, that would be great. That gives you guys about 24 hours to pull something together. Will
Okay.
that work?
Yes.
Okay, thank you. So with that, then we will adjourn and we will take this up tomorrow at noon.
Thank you. Thank you, Madam Chair.
Thank you.
Sir. Thank you, everyone. Thank you, Madam Chair. Good job, Charlie.
Yeah, thank you.
Gonna be okay? Yeah. Okay.